So I want to bring in Diane Colmer, a retired telecommunications lobbyist. Diane.
Hey, Diane.
Thank you, Dana. And welcome to Drake, Congressman O'Rourke.
Thank you.
I have multiple sclerosis, and this disease is treated with very expensive pharmaceutical drugs. In addition to the ever-increasing costs of my generic drugs, the cost of the primary drug I take for the multiple sclerosis now retails one dose at $21,800. I get this every 6 weeks, $21,800 for a little bag of clear liquid that is infused in my chest. It has depleted our savings, and I worry about how we can afford the ever-increasing costs of these drugs that reduce the progression of my MS.
Diane, thank you for being here. And again, for having the courage of sharing your story so we all understand the consequences of the policies that we've adopted in this country. You should be able to get the care that you need to live your life to the fullest. And cost should not be an object or a concern or an anxiety of yours. I want you to focus on being well and doing well for others. To add insult to injury, you and I, as taxpayers, have funded so much of the research and development for the cures and the medications and the pharmaceuticals that are sold back to us at the highest prices on the planet. We prevent you from buying from Canada or from Europe or somewhere else where you can purchase it cheaper. And we refuse to use the purchasing power of Medicare, the leverage in all of the prescription medications that we buy for those beneficiaries, to drive the price down. We have a plan to address this. We're going to make sure that every single American has access to high-quality, universal health care without exception. There's a plan called Medicare for America. That will ensure that everyone who does not have care today is enrolled in Medicare. Those who have insufficient care, they can't make the copay after insurance kicks in or afford the premium or bridge the deductible, they can choose Medicare as well. But those who have employer-sponsored insurance and like it because it works for them and their families are able to keep it. And we use the leverage of this government, not just for Medicare, but Medicaid beneficiaries, VA beneficiaries, TRICARE beneficiaries, to bring the prices of these medications down so that you and other Americans can afford them. That's what we should be able to do. Thank you, Diane, for asking the question. Appreciate it.